Today, we're going to talk about a drug that's been a real workhorse for type 2 diabetes for decades, Glyburide. It's powerful, it's incredibly cheap, but it's also, well, a bit of a double-edged sword. Let's dive into why. So, have you ever wondered how one little pill can basically hijack a part of your body and force it to lower your blood sugar? The way Glyburide works is a really clever, but also pretty aggressive biological trick. Okay, first things first. What exactly is Glyburide? This isn't some brand new cutting-edge medication. Nope, this is a classic, a true veteran in the fight against type 2 diabetes. Glyburide is part of a drug class called sulfonylureas. You can kind of think of them as a special ops team whose one and only job is to march up to the pancreas and tell it, release more insulin, now! So you might be asking, why has this drug stuck around for so long? It's actually pretty simple. One, it works really well at lowering blood sugar. And two, it is incredibly cheap. But here's the catch. It's totally useless for type 1 diabetes because it needs a functioning pancreas to do its job. All right, let's get into the really cool part, how this drug actually pulls it off. It's a fascinating bit of biochemical engineering, you know? But like I said, that cleverness comes with a price. The best way to think about it is this. Glyburide doesn't just gently nudge the pancreas, it hotwires it. It completely bypasses the body's normal, careful signaling and just forces an action. And that's both its greatest strength and its biggest weakness. Okay, so let's break down this four-step process. First, the Glyburide molecule finds a special docking port on your pancreas cells called the SIR1 receptor and latches on. This sets off a chain reaction. It forces a tiny gate, a potassium channel, to slam shut. Now with the gate closed, potassium gets trapped inside the cell, which flips the cell's electrical charge, kind of like flipping a light switch. That electrical jolt signals another gate to swing open, and a flood of calcium rushes in. And that rush of calcium is the final signal that tells the cell to dump its stored insulin into the bloodstream. And this all happens in an instant. And this right here, this is the most important thing to understand about the whole process. Your body is smart. It only releases insulin when blood sugar is high. But Glyburide, it doesn't care. It forces the pancreas to release insulin whether your sugar is high, normal, or even dangerously low. It completely overrides the body's safety checks. And that fact is everything. So as you can probably guess, that brings us right to the downside, the catch. Because when you force a biological process to happen without checking if it's actually needed, there are always going to be consequences. And the number one risk, which stems directly from that mechanism we just talked about, is hypoglycemia. That's the medical term for dangerously low blood sugar. I mean, it makes sense, right? If the drug is screaming, release insulin, even when you don't need it, your blood sugar levels can absolutely plummet. And hypoglycemia isn't just, feeling a little woozy. The mild symptoms are no fun. You're sweating, shaking, you feel intensely hungry. But if you don't treat it with sugar right away, it can escalate fast to some really severe stuff like confusion, seizures, and even a coma. This is the real danger of the drug. Now, this risk isn't the same for everybody. It's much, much higher for older patients and for people who have kidney or liver problems because their bodies just can't clear the drug out as quickly. And of course, if you take Glyburide and then skip a meal, well, you're pretty much setting yourself up for a dangerous drop. Here's a little detail that's actually super important. In your bloodstream, over 99% of Glyburide is latched onto proteins, just hitching a ride. That means less than 1% is active and doing the actual work. So what happens if you take another common drug like aspirin or warfarin? Well, they can knock Glyburide off those proteins, suddenly flooding your system with the active drug and seriously cranking up your risk of hypoglycemia. So besides low blood sugar, the other big side effect you hear about is weight gain. See, insulin is a storage hormone. Its job is to tell your body to store extra energy. By forcing more insulin into your system all the time, Glyburide is basically encouraging your body to store excess glucose as fat, which is often the exact opposite of what someone with type 2 diabetes wants. So with these pretty significant risks, you have to ask, where does a drug like Glyburide fit in today? Well, its role has definitely been changing over the past decade or so. This table really says it all. Glyburide's one huge advantage is cost. It's dirt cheap. But look at the trade-offs. The newer drugs, they have a way lower risk of hypoglycemia. They're often neutral for weight or even help you lose it. And, this is the real game changer, they actually provide proven benefits for your heart and kidneys.
That is a massive deal because heart and kidney disease are two of the biggest threats for people with diabetes. Glyburide just can't do that.
So why is it still around? Honestly, it comes down to access and cost. For a lot of people around the world, or even here, for patients without good insurance, the crazy high price of these newer drugs just puts them out of reach. So, Glyburide, for all its flaws, remains a powerful, effective, and affordable tool that millions of people still rely on.
And that leaves us with this central question, the core dilemma of Glyburide. It's undeniably effective and affordable, but it comes with serious, predictable risks. It really forces us to ask a tough question in medicine. When is a cheap, powerful drug actually worth the risk? And there's no easy answer. It all depends on who you are, where you live, and what other options you have.